My doctor has ordered a nasogastric tube to be inserted into my patient. So first I need to check and review the doctor's orders and confirm which patient it is before I head to their room. And I also need to review the facility policy. Okay, next I need to gather my supplies, which includes the nasogastric tube, tape, gloves, water-soluble lubricant, tissues, water or ice chips for the patient to eat, 20 to 60 milliliter syringe with an adapter. Next is an emesis basin, a pH test strip, and then next is a stethoscope, a towel or absorbent pad, suction apparatus with tube or canister attached and prescribed, and also clothespin and elastic bands. Okay, so now we will head to the patient's room. Okay, and knock knock. Hello, it's me again, Mindy, your nurse. How are you today, Mrs. Jones? Alright, good. Today I'm here to insert a nasogastric tube, so to help you get the nutrition that you need. Alright? Okay. And then now I'm going to perform hand hygiene and don my gloves. Alright. Now I will use two patient identifiers before I start the procedure. Alright, Mrs. Jones, can you please tell me your name and date of birth? Alright, thank you. I'm just going to check your wristband as well. Thank you. Alright, now I'm going to assist you into high phallus position and raise the bed up to a working height. And I will make for patient privacy and make sure that the patient is comfortable. And I will assess if the patient is able to tolerate the procedure, just generally. Do you have any throat pain? Pain in your nose? No? Okay. Alright, now that I've assisted the patient, I will now assess the patient. So I will get my pen light and ask Mrs. Jones to hyperextend her neck for me. Just tilt your head back. I'm just going to check the nostrils for any abrasions, occlusions, anything out of the ordinary. No. Skin integrity looks intact. Okay, and now I'm just going to ask Ms. Jones, alright, I'm just going to cover one nostril at a time and test the airflow. So can you take a deep breath? Alright, thank you. Another one. Alright, thank you. And we are going to select the nostril that has the greatest airflow. Alright, and after we've selected nostril, we are now going to start preparing the tube. So we're going to get the tube, measure from the nose to the earlobe, and from the earlobe to the xiphoid, and mark it with a piece of tape. Okay. And then after we've done that, we are now going to cover the patient with a towel, protect them from any secretions that might leak out. Okay, and then now we will take the tube and lubricate it well at the tip with water-soluble lubricant. And now we will instruct the patient to hyperextend their head, and we will insert the tube gently, following the natural curvature of the tube. Thank you. Alright, once we feel we are approaching the nasopharynx, we're going to ask the patient to tilt their head forward and take sips of water before we advance anymore. And now we're going to also make sure that we are advancing towards the earlobe, closer to the nostril that you have selected. And with each sip, we're going to advance 2 to 4 inches. So can you please take a sip? Alright.
That's for macro. Yes, I know like 15 minutes.
don't want to force it.
It depends on what the order is. The doctor orders how much they want per minute. Or
Can you take another sip?
however many mLs per minute.
Right, yep.
You don't mind.
Take another sip. Alright, thank you.
I don't know, so I'm not gonna answer.
Gently, gently. Gently. Alright. Another sip. Alright. Doing great, Mrs. Jones.
Yeah, that's the same.
And now we've finished inserting to the indicated length, so we will just secure very quickly the tube
As long as it's
to the base.
Check that out. Now I can take.
Now we need to check for correct placement. So first, one thing that we can do is use our stethoscope. First we will attach the syringe,
no, for us, because we can't.
inject 5 to 20 milliliters of air, and listen for a whooshing sound.
Yeah, well, as far as I know, you don't really have to calculate
It's hard to see. I wish it was a different color.
Everything goes through pharmacy.
And if a whooshing sound is heard,
So many milligrams or
then
whatever per
that
hour.
is a good indication of placement, but not the one that you should solely rely on. And then now we'll aspirate the stomach contents
But you need to learn it from.
and test the pH. We are looking for a pH of 1 to 5 that would indicate placement in the stomach. If the pH was higher, for example, like 6 or higher, then that would indicate placement deeper than intended into the duodenum. Okay, and after that we would need to review for confirmation of placement by x-ray. And then we need to secure the tube to the bridge of the patient's nose with more tape. Alright, and then after the nasogastric tube is placed, we need to connect the tube to the prescribed intervention, which could be either a suction or it could be the tube feeding. And then after we finish, we can discard the supplies, perform, remove our gloves, perform hand hygiene, and place the patient bed in the lowest position. And we are going to document that nasogastric tube insertion was performed and that the prescribed intervention was done and any other pertinent observations. And then now we're going to talk about the troubleshooting. So if the tube met resistance, we're going to need to withdraw the tube, re-lubricate it, and insert in the other nostril. If the patient gagged, we're going to need to stop advancing the tube, allow the patient to rest, take a few breaths, and take sips of water until their gagging stops. And if the tube is found to be placed in the wrong place, we are going to need to withdraw the tube and start again.